Hello there, Dr. Ibe, once again, your platform medical advisor. There have been a lot of interest and queries regarding diabetes and its complications. I've had queries, couple of two, three really, people telling me that their family members have gotten diabetic kidney disease. But before we talk about that, let me say this once again, and I think we had mentioned this in the past that please, we don't want any unwanted messages on this platform. This platform should be just for medical queries and medical advice. So please, any other message you see on this platform is not approved by me. So I feel like clarify this. So please, no unwanted messages on this platform. Now, let's come back to the topic of today. We have spoken about diabetes in the past severally, and let's talk about that once again. Diabetes is a very bad disease. We try to manage them aggressively. It is equally in the increase. Diabetes has a lot of complications apart from that of heart attack leading to death, and that of stroke leading to permanent disability. There are other complications we get worried about that can be reversed. And the first one is the diabetic retinopathy, which is diabetic heart eye disease. Then there is diabetic nephropathy, which is when diabetes affects the kidney. The nephrons are the filters of the kidney, and that can be affected, therefore leading to kidney damage and kidney failure, then dialysis. Then that's what we call diabetic neuropathy, which means when the diabetes affects the nerves, that can lead to amputations. I've got patients whose toes and limbs have been amputated because of a poorly controlled diabetes. Now, when it comes to the eye disease, diabetic eye disease, I would strongly advise that if you start experiencing any sort of blurred vision, impaired vision, soreness of the eye, redness, you need to see an optician or an ophthalmologist trained to assess diabetic eye disease. And when it comes to kidney disease, your doctor should do a kidney function test in the form of urea and creatinine, and sending your urine to the lab to check for what you call albumin and creatinine ratio. These are indicators for kidney disease. And when it comes to diabetic neuropathy, if you start experiencing any sort of numbness in the limbs, pins and needles, or not feeling any of your toes, these could be indications for diabetic neuropathy as well. You need to see a trained nurse or doctor indeed, who will check your limbs, your toes, make sure that the sensations are intact, the pulses are there. And when this is checked, if there is any sign of oncoming diabetic neuropathy, that can be treated. So yes, I felt I discussed these complications of diabetes. So once again, apart from the heart attack leading to death, apart from the stroke leading to a permanent disability, we equally have diabetic retinopathy, nephropathy, and neuropathy. Okay, when I do my medical outreach in Africa, I see people telling me that I was told I have sugar disease, but I'm fine now. How can you say that? How can you say that you're fine when you don't go for regular checks, when you don't go for blood tests and so forth and so on? So this diabetic retinopathy, nephropathy, and neuropathy needs to be checked at least once a year, and indeed sometimes even twice a year, every 6 months, depending on the findings. So these are routine checks we do in the UK to check for diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. These checks have to be done at least once a year. Yeah, once again, I know all of us are keeping safe and being safe as well, playing safe indeed. Yeah, please take care of yourselves, your family members, your loved ones. So in this period of COVID 19, let's all keep well. It is well indeed. Okay, God bless. Bye.